Welcome. I'm Jerris Hedges, Dean of the John A. Burns School of Medicine, and we are doing this white coat ceremony virtually this year, but I really appreciate you participating with us and hearing some of the important messages that we give to our entering students each year. Normally we do this after the first week of medical school is complete. Now we're doing it after about 1.5 months of exposure, but the messages are very similar. This is a welcome to the profession, and it's important that our students see this as a calling and a true profession. And as family members, those of you watching this with your children who are now students at John A. Burns School of Medicine, you will, of course, be some of the first patients that these students will see and work with. Just give you an example from my own background. My father had a heart condition, had a heart murmur that I was aware of even before beginning medical school. And he was also quite limited in what he could do because he could not exert himself very actively. And although he worked 2 jobs to keep things going for the family, he also was not able to do anything with significant exertion at any one time. And as I progressed in my medical studies, I realized that he was suffering from advanced cardiac heart failure and needed a new heart valve, which at that time was a fairly new phenomena. And as the only one with medical knowledge in my family, I had to work with local practitioners, find those who had some knowledge about the availability of heart valves, and get him into treatment so that he could be cared for. And so learning to manage conditions in one's own family really brings home the importance of what one has to do as a physician. In the case of my father, it was expected that he probably had another year or 2 to live with his failing heart. But with the new valve, he was able to get an additional 30 years of life. And that's the sort of difference that we can make as physicians. And it's one of the reasons I like to speak about the kuleana that our young physicians in training have. Kuleana, of course, represents both privilege and responsibility. Each of the students in our class has great privilege. They now have the opportunity to learn a profession that can help them, help their family, and help their community. And it's the responsibility to do all of those things, to help keep oneself healthy, to keep one's family healthy, and keep the community healthy. That is the responsibility of a physician. And we have to undertake this as a profession, not for personal advancement, but really to contribute to the overall health of the community. Now, as you are aware, during this time of COVID, there is considerable risk to healthcare professionals. But I want to remind you that throughout the ages, physicians have had significant risks to their own health and to that of their families. And they've seen that as part of their responsibility to mitigate that risk, to take precautions, but not to shirk from their duty to deliver care and to minister for those in need, whether they can be cured or whether it is comfort that the patient will benefit from. So I encourage you as family and the students who are being recognized in this white coat ceremony to realize their kuleana, that it is really important that we not shirk our duty, that we not look for ways to avoid meeting patients, working with patients, but rather we look for ways that we can do it to help our patients and do it such that we protect our families and ourselves to the greatest extent possible. But there is always risk in being a physician. And it's important that all of you are supportive of those who are learning and appreciate the effort that they will put into this profession, and that they in turn give back to the community and to their families all of the care that they possibly can, because Hawaii needs these practitioners. So thank you for being here today. Thank you for being a part of this welcoming ceremony, and we're very proud of these young physicians in training. Mahalo.